Giardiasis is an intestinal infection caused by protozoan parasite, named Giardia dudenalis. It is also known as Giardia lamblia or G.intestinalis. It is a common cause of waterborne diarrheal illness worldwide. Etiology of Giardiasis. Infection with Giardia lamblia is common in tropical countries. They attach to mucosa of duodenum and jejunum, and produce inflammation and partial villus atrophy.
Transmission of Giardia. It is transmitted through contaminated water, which means drinking or swimming in untreated water, such that lakes, rivers, pools. Person-to-person transmission means the poor hygiene, especially in daycare center. Foodborne transmission, eating undercooked or contaminated foods. Animal contact, pets, such that dogs or cats, and livestock can carry Giardia. Clinical features of Giardia, which includes urgent diarrhea, abdominal discomfort, loose pale stools, lethargy, flatulence, abdominal distension, epigastric pain, and nausea. Giardia may cause severe malabsorption by producing villus atrophy. Diagnosis of Giardia. These are stool testing, microscopy of stools to look for cysts or trophozoites. It may require multiple samples. Stool antigen test, such that ELISA or immunofluorescence, which is more sensitive test for Giardia. PCR testing, which is used for genetic detection of Giardia. String test or entero test, it is rarely used now. It involves swallowing a string to collect duodenal samples. Treatment and management of Giardia. It includes antibiotics, such that metronidazole for 5 to 7 days, and tinidazole, single dose. Second-line treatment is supportive care, which includes oral hydration solution, and probiotics, which helps in restoring normal flora of gut. Prevention of Giardia. These are water safety, means drinking filtered and boiled water. Avoid swallowing of water in lakes. Hygiene, hand washing with soap, especially after toilet. Proper sanitation in daycare center. Food safety, washed food and vegetables. Avoid raw or undercooked food. Complications of Giardia. It can cause chronic diarrhea and malnutrition, especially in children. It can cause post-infectious irritable bowel syndrome, IBS. It can cause lactose intolerance.